update here with my wingmen, Paul and Josh, and Glendolyn Thames will have an opportunity to introduce to you in a minute from Department of Economic and Community Development. Let me just do a quick look at our current numbers here. There's a bit of a catch-up here. If you're wondering, hey, tests performed look like they're up a lot, positive cases up a lot. That reflects the fact that some of the tests coming back. Deaths are still disturbingly high, and I'm tired of saying that reflects what happened 3 or 4 weeks ago. Hospitalizations, a little more current. That number continues to creep up, but still at a much slower pace than where we were a week or two ago, and that's really good news. Next slide, I think, is similar to what you've seen before. Fairfield County continues to be flat, well under control. New Haven is flat, under control, and Hartford continues to ramp up. One little tidbit on that before I go, I think I mentioned to you the How We Feel app, where we now have about 32,000 people, largest per capita in the country. Keep going. It gives us at least some information at this point. It's still small, but if you look at these numbers, it's sort of interesting to me that New London County is the county where, according to How We Feel app, you're most likely to social distance. Good going, New London. And you also have the lowest hospitalizations, or near the lowest. And Fairfield County, ironically, is the county where you're least likely to social distance. But even there, it's pretty good. Over half the people in Fairfield County social distance. Another interesting trait, I think, is mask wearing. Relatively new. Getting some feedback on that. New Haven is the county where you're most likely to wear a mask. Nice going, New Haven County. That's 32%. And Tolland County is the county where you're least likely, and they're not even registered on my total hospitalizations. So much for that theory, but it's still interesting observations on what that means. The next chart reflects daily admissions. I don't like this that much because it's just a short-term look over the last 3 days, but again, you see Hartford ramping up the most. You see Fairfield went up just in the last day or so, probably a one-day spike, I'd like to believe, and New Haven went up. So those are things just to remind people that we still have work to do. And we still have this under control. We have our hospitals have capacity. The indicators are trending in the right direction, but we are by no means out of the ditch on this, and that's what we got to focus on. I want to just back up for 1 second because last night you probably saw that the Senate passed a large, what they call supplemental, a big bill that reflects about $400 billion. I was with Senators Murphy and Blumenthal today. They made the bill much better, especially the fact that it focuses on small minority-owned businesses, gives them a better opportunity, and Glendon will be able to talk about that in a little bit. I also spent an hour with all my fellow governors, and I'll just give you a perspective on how they look at things, how Connecticut looks at things, and how we square off on that. I think of most interest to all the governors, bipartisan, both sides of the aisle, they really wanted to see a supplemental, they wanted to see money in there to pay back lost revenues at the state level. That didn't make it in the last bill. That was a big bill, $2.2 trillion a couple weeks ago. It didn't make it into this bill. And you may say, well, who needs it, governors? You got $150 billion in the last bill. And that's a lot of money. And that money pays for all the COVID-related expenses. They reimburse for those expenses. What that doesn't pay for, where the states are on their own, is the lost revenues. And in the state of Connecticut, where I'm most familiar, we're looking at a deficit of about $500 million at the end of this fiscal year, June 30. And of that deficit, 85% of that is related to lost revenues. Maybe 10–15% is related to COVID-related expenses that aren't reimbursed. And the reason that lost revenues are so big is because, unlike the last recession, where income taxes went way down, but sales tax kept going. People continued to buy. In this recession, it's true of every state in the country. Not only have income taxes disappeared, but also so is sales tax. We were a little bit mitigated because of our sales tax on internet sales. And that's why a lot of the states are feeling a little desperate right now. And I could certainly hear that on the phone call. Governors thinking about having a special session of the legislature to slash spending or increase taxes. Governors talking about bills piling up on their desk, just a sense of urgency. And we're not in that position. As I've said before, thanks to a rainy day fund, thanks to a strong cash position, thanks to people being relatively conservative in our budgeting, we're in good shape, I believe, through this fiscal year, assuming no surprises. We'll see what happens, whether the states get any of the money in the next bill, the fourth supplemental, which will come up. The president in that bill is most interested in transportation infrastructure, as am I, as you know, ad nauseum. We talked about it for a year and a half. The president has also said that he'd be flexible or interested in taking a look at the $500 billion that the governors are looking for. The good news is he's given us a little bit of flexibility in the last revenues, so we can apply some of that perhaps to revenues. But the prospects of getting any more from the feds is cloudy at best. Mitch McConnell, the Republican who leads the Senate, where there is a majority, was not very happy about the idea of giving any additional money to the states. And he said if a lot of them are in trouble, maybe they should just think about filing for bankruptcy. Marie Antoinette said, let them eat cake. Mitch McConnell said, maybe let them file for bankruptcy. We'll see what happens on that, but I have a different philosophy. Rather than sit around complaining about what's going on in Washington, D.C., we're trying to focus here in Connecticut in terms of what we can do to mitigate things and take control of our own destiny. You know what we've done on the financial front in terms of rainy day fund and our cash position, which protects us at least for now. We spent a lot of time the last few days on testing, and there's a lot of complaints that they're not getting the testing ingredients and the swabs and the reagents from the federal government. Okay, so be it. But we've established some very strong corporate relationships, and that gives us a big advantage in terms of getting what we need to do the testing. You know, a few weeks ago, I talked to the CEO of CVS, Larry Merlot, said how important his relationship is for the state of Connecticut, what he can do with the Abbott lab drive-through testing, one of the first states in the country, up and operating in New Haven with the necessary testing agents to get that done. You remember yesterday we had the CEO of Quest, the leading testing company probably in the country, a Connecticut guy by birth, and what he's able to roll out with Hartford Health to increasingly ramp up our testing, almost doubling it over the course of the next week. So anything I can do where I don't have to sit around blaming it on the Chinese or the national stockpile, we can take control. That's what we're trying to do. Today I was there at Battelle. I think I mentioned that to you. We're the 7th in the country Battelle Center where we will be able to sanitize 80,000 masks, N95 masks every day. And they've already done just a few hundred a day today, and that will ramp up very quickly. And we were on the phone with Battelle probably 2 weeks ago, and 2 weeks later, here we are. There are 60 other locations in the queue, and Connecticut is the 7th up and operating. So I think Connecticut should be proud of where we are, utilizing those relationships, doing whatever we can within our own capacity to add to our PPE stockpile, add to our surgical masks, and add to our testing and protect ourselves financially. You know, with that, I'd like to talk to you just briefly about the bill that passed last night. Tomorrow, it goes through the House of Representatives, where I believe it will pass as well. Really important. It provides another $75 billion for hospitals, not Connecticut hospitals, hospitals across the country. That's on top of the $100 billion they got in the first tranche. You know, of that $100 billion, only 30% of it has gone to our hospitals here in the state of Connecticut so far. So we're not out of the woods, but at least there's a sense of direction there. And over time, we can look at hospitals and how they can do some of the elective surgeries, which help get them standing on their own 2 feet. I think that's pretty good news. In addition, there's about $25 billion for testing. So we're going to be taking a look at that. Josh is taking the lead on a track and trace in ways we'll be able to get to the front of the line for some of those federal revenues. So we'll take what we can get. But the biggest thing they've done and really kept faith, and I'm really proud, is the fact that they kept faith with our small businesses. And in terms of another $320 billion, you remember that last tranche of small business, it was tapped out within about 10 days, 2 weeks. And Connecticut did pretty well. I mean, we got 18,000 loans done, about $225,000 on average per loan. That's about $4.2 billion. So we did pretty well compared to our region here. So thankful for the work of our banks, thanks for the work of DECD and all the small businesses that seized the opportunity. But we also have another 15,000 small businesses that got frozen out and didn't have enough in that pool to take care of them. So they'll be in the queue, and we'll be able to tell you a little bit, Gwendolyn will, about what their status is. In particular, thanks to Senators Murphy and Blumenthal, we have a pretty good set aside, about $60 billion of that for small business, minority-owned business, women-owned business. I mean, I think you saw in that first tranche that big restaurant chains like Shake Shack got a heck of a lot of money, and a lot of the small restaurants maybe did not get anything. And they're the folks we're fighting for. They're the folks that are on Main Street and don't have any other source of revenue to live off of. So with that, Gwendolyn, how can we get those folks to the front of the line and make sure we get our share in this next tranche?
Thank you, Governor. Absolutely paramount. So during my time, I just want to focus on updating our small businesses and our residents relative to capital resources for small businesses during these unprecedented, challenging times. So we have done a business impact survey. So we did one initially during the first couple of weeks of COVID, and we have since done a second one that we launched next week. And so preliminary results, again, are continuing to show that overwhelming respondents are saying that access to capital and cash flow is paramount to them being able to sustain their business operations. So that said, the federal dollars that are coming down the pipe and re-upping essentially the first tranche of the CARES Act that the governor mentioned is paramount. So I just want to kind of provide some updates during my time relative to resources on the federal level, but also resources that are available at the state level. So there was significant improvements and reforms that were made through the second round of the federal funding that the governor mentioned. Businesses should be ready to apply for these dollars by as early as Thursday night or Friday morning. Two major improvements were focused and made through this last round. Again, a focus on minority-owned, rural, and underbanked businesses, as well as allowing farmers and agriculture enterprises to be eligible for the economic injury disaster loans, which they were not previously. So in the first round, as the governor mentioned, $4.2 billion was allocated to Connecticut, 18,000 loans here, which covers about 20 to 25% of our small businesses. So again, essentially, there's still a significant amount of small businesses here in our state that have not been able to access these dollars. But again, through the second round, we hope to change that. We have been trending on pace with what we would expect given our population size and GDP. And so again, but we just don't want to keep pace. And with our expectations, we want to outperform. And so we've really been having a coordinated effort with our banks, with the SBA, to ensure that Connecticut businesses are accessing these dollars and getting their fair share. So the second round presents a new opportunity. $310 billion in additional lending authority for the Paycheck Protection Program. And of that, $60 billion is going to be set aside for smaller lenders. So those are lenders that have smaller deposits, your credit unions, your community financial institutions that are, for all intents and purposes, in better positions to help minority-owned businesses, again, underbanked, who have traditionally been disproportionately impacted and have had barriers to accessing capital. And so a lot of those kind of loopholes were really kind of the focus of our federal delegation, as well as Congress with this next round. So we hope to see those adjustments and more dollars being accessible to those communities in this round. But again, it definitely is going to take a coordinated effort on the state's front and working in coordination with our credit unions and our banks. And I will say DECD is in close conversation with the Banking Association and the Connecticut Credit Union League as well to ensure that they're best positioned to access and make these dollars available to those communities and access those set-asides, if you will. The second piece is there's $60 billion for the SBA Economic Injury Disaster Loans. That's the EIDL program. Again, this was one of the first programs that was out there in the market from the feds before the PPP and other loans were available. This is getting re-upped essentially as well. So again, a total of $60 billion there. On a state level, I just want to kind of recap relative to the Connecticut Recovery Bridge Program. We are still on pace to ensure that we can deploy over 5,000 applications that we received and get those dollars to small businesses that are approved for those loans by the end of the month. We have our HEDCO Minority Business Initiative, which is the access to a line of credit up to $20,000 for woman-owned and minority-owned with a forgivable loan forgiveness feature. And again, those are for your smaller mom and pop Main Street businesses. So again, I encourage people to apply at www.headcoinc.com. And next, again, I just want to reiterate, there's a vast network of partners in our ecosystem here, the Connecticut Business Development Center, the Women's Business Development Center, the Spanish American Merchants Association, SAMA, just to name a few that are here and available to help you with technical assistance, but also ensure that you can apply, you understand these applications, and you're submitting complete applications. So again, there's opportunities there. We have our DECD hotline, 860-500-233, 860-500-233. Again, I encourage everybody to reach out to us. We have a dedicated team that is available and there to help businesses navigate through these very challenging times and connect you with the right resources. Last but not least, I think the main takeaway and call to action for small businesses is, again, if you have submitted an application, you have an application in that pipeline for PPP, immediately contact your bank and check on your status. If you haven't applied, please get in the queue and apply for these loans through your local bank, which could be an approved SBA lender, but check out that list on SBA.gov. Again, but get in the queue, get yourself ready. And in addition, I think this is important to understand and kind of share this information relative to alternative financial lenders that are online. So PayPal.com, QuickBooks.com, SquareUp.com, OnDeck.com, just to name a few, are online lenders that, again, is a real alternative. If you do not have an existing banking relationship, you can easily access these through your smartphone or online and apply through those means and mechanisms efficiently and quickly through these programs. So I put that out there as an option to everybody, and this will be on our main coronavirus website as well. So with that, I will stop there and just tell everybody from a small business perspective, again, get in the queue, get geared up to be ready to apply for these loans as early as Thursday night or Friday morning. Thank you.
Thank you, Glenn. Any questions, Max?
Hearst, Connecticut Media.
Hey, Max, thanks. Governor, can you hear me?
I sure can.
Thanks. Governor Cuomo was talking about contact tracing today in cooperation with Connecticut and New Jersey. Can you give us some details on that?
Yeah, we're just beginning to talk about that. Contact tracing, as you know, it goes back many, many years. It's a way, they're doing it in New Haven right now with volunteers, a way that you can find out somebody who has been infected, give them a call, find out who they've been in contact with, and give them a little notice and warning. In addition, there's some certain applications, apps, computer apps they're thinking about expanding as well. So Cuomo's thinking about including New Jersey and Connecticut as part of a consortium. We might be able to work together on this, but still to be determined. Anything else on that, Josh?
Yeah, just to add, our team at Department of Public Health has been working on this topic for several weeks now, and we're actually quite deep into evaluating some new cloud-based platforms that can help take what the governor described as basically a 100-year-old process of infection control and bring a lot of modern technology to it that'll help us really work more closely with 64 local health departments, coordinating with the state, also helping to share resources and volunteers where there may be more need in one area. So we've got a lot of exciting announcements to come on that in the near future.
So it's too early to talk about what the state might have to provide as part of the tri-state effort.
I think it's too early to talk about that specifically, but what contact tracing does do is allows us to isolate the virus, slow down the rate of the spread. Right now, Connecticut, by a number of metrics, is doing pretty well in slowing the rate of the spread, but we can do better with contact tracing.
Thanks, Governor. Also, I've got a couple of constituent issues, minor things, but people want to know why they can't fill out learner's permits online at DMV, and why can't they take an online boater safety course at DEEP, among other things. Do you want to get really granular for the people right now?
Paul does.
That's what I'm here for.
Paul.
How you doing, Ken? Yeah, so
Hey, Paul.
on both of those issues are both issues that our departments are working on. As you know, under our executive order powers that we have right now, we will have to take those further actions. I was actually in direct contact with our Commissioner of DEEP, Katie Dykes, as it deals with the boater related issues, so there should be more news to come later this week on that issue directly.
Thanks. And Governor, this will be my last question. Thank you. But I'm getting complaints from people who've been trying to get unemployment benefits for 4 weeks now. And what kind of hope can you give them?
The hope is that we're just about caught up on all the traditional benefits. The workaround on the old Cobalt system is working. I think 90% of the jam-ups right now are related to the freelance independent contractors. I heard this from 49 other governors this afternoon as well. And since you can't do that online, those are the folks who are making the calls and creating the busy signals. We're working that with the federal government, and I believe that Kurt is hopeful we'll have some solution on that in the next 2 weeks, retroactive from the time you applied. I apologize for the delay, but it is a brand new program.
Thanks, Governor.
Thanks, Ken.
The Day of New London.
Hi, Governor. Julia Bergman from The Day. My question centers around the Department of Public Health inspections at nursing homes. Can you give an update on that? Have those begun, and are there any consistent findings on how the virus is spreading within those homes?
I'll start. We have begun those inspections. We wanted to be very close to the action, what's going on there. I think Josh said we've been to 59, 60 nursing homes at this point, personal inspections, checking on the PPE, checking on the infection protocols, checking on the reporting to make sure that we get a firm grip on what's happening there. Josh mentioned of those 59 nursing homes, one had a real need for PPE, and we got that to them.
Move along next to the Waterbury Republican American.
Thanks. Governor, we're taking a look at the kind of per capita infection and death rates in Connecticut And what you see when, at least when we do some of the sorting, is a mix of towns and cities of all sizes, primarily from Hartford, New Haven, and Fairfield counties. What are your administration seeing in terms of these per capita numbers?
The question was about the per capita numbers when it comes to infections, when it comes to fatalities. First of all, Paul, you're right. That I-95 corridor has been the heart of the COVID corridor. It started in New York and coming right up all the way to Hartford, where it is still ramping up seriously. The infection ratio, I think, is primarily a function of how much testing we're doing. And we've done relatively strong amount of testing compared to most in our region, with the exception of New York. The fatalities is really troubling to me. We have a relatively high fatality ratio. I think there are a couple reasons for that. First of all, Fairfield County was adjacent to the heart of the American pandemic, and there were the infection rate, the hospitalization rate, and the fatalities were strong. And the other thing worth thinking about is how we define a COVID-related fatality. You maybe remember in Wuhan that they ended up doubling the number when they said that anybody who had COVID-like symptoms, they were going to call a COVID-related fatality. We have a broader definition on that. We follow the same definition, by the way, as the CDC and the federal authorities do. Other states have a narrower definition. I think that law will be clarified probably in the next month or so.
And in terms of the Connecticut Bridge Loan Program, I'm not sure what deployed 5,000 application means. So are we saying that at the end of the month, of those 5,000 applicants, those who have been approved will find out that they've been approved and will start getting their money? Or is it all 5,000 or 5,000 businesses are going to be approved at the end of the month and get their money?
Could you hear that, Gwendolyn? The question about the bridge loan program, the 5,000 applications who have been approved, are they getting the money and when? Mute.
Yep.
Can you read lips?
Yeah, no. Unmute.
You're still on mute.
Sorry,
Yeah.
my computer is acting a little fickle. Can you hear me now? I think so.
Yes.
Okay, great.
Yes.
So we had over 5,000 applications. We are now kind of engaged in a new partnership with a fintech firm, SoFi, who is helping us completely automate that process. And so our goal now is to, again, speed up our loan review process, and the goal is still to ensure that we can get this money approved and out the door to small businesses that are eligible, and we approve by the end of the month, April 30th, plus or minus. Okay.
And Governor, real quick, just back to Ken's question on this contact tracing possible arrangement. I believe the other day you mentioned you had some concerns about civil liberties. So what are your concerns about entering into such an arrangement?
I don't have concerns because Connecticut's going to do it right. We're going to do it on an absolutely voluntary basis. We're going to do it on an anonymous basis. It's there to help keep you safe and keep your friends safe who you've been in contact with. So when we do it on the personal basis, when a monitor's giving you a call like they're doing in New Haven, you can decide whether you want to participate or not. If we go with one of the social platforms, it's an opt-in. So I want people to have confidence that we respect their individuality, their anonymity. That's not going to be made public. And I do encourage people to participate because it will slow the rate of increase.
Okay, thank you very much.
Fox 61.
Zania Maldonado, Fox 61. Gwendolyn, you shared you already have 5,000 applications for the Paycheck Protection Program in the pipeline. How many more applications could you guys possibly approve with this second round of federal funding? What's Connecticut's slice of the pie?
So just to make the distinction, there's two programs. So the Connecticut Recovery Bridge Program is the state economic development department's program that we launched earlier, March 25th to be precisely. And so that is the pool of applications that I mentioned that was over 5,000 that we're processing. The second component is the federal dollars that are coming for the Paycheck Protection Program through the federal government. So they're putting an additional $310 billion towards this program that we, again, are trying to understand what our fair share of it could potentially be. To date, our small businesses here have gotten $4.2 billion and 18,000 loans, which is on par relative to our population and size. But again, we want to outperform those numbers in the next round.
And then, while covering personal nursing home stories, we've had residents tell us their loved one was too old to meet the criteria to go on a ventilator, and that ventilators are being prioritized for those who, quote, have a better chance at survival. Is there criteria a patient must fit before being placed on a ventilator? Does age matter?
No, it absolutely does not. We have not had a single hospital in the state of Connecticut since this started run out of ventilators. So any decisions about which patient is going to be intubated is a purely clinical decision based on the physicians that are attending to that patient. So we have more than ample supply. In fact, as we sit here right now, less than half of the ventilators in the state of Connecticut are being used.
Move on next to Channel 3 Eyewitness News.
Hi, I have a couple of questions here. Going back to the How We Feel app, do we know how many people in Connecticut are using it? And then my next question is, we've gotten some reports that some stores in Connecticut, especially the big box stores, are allowing customers inside the store without a mask. They're saying they can't enforce the mask or because it's only recommended. Would you ever consider making changes to the executive order on masks to be mandatory?
Yes, I would, if I find that people are not enforcing that and not taking it seriously. Obviously, there are medical exemptions. There's some people that just can't use a mask, little children who are too young, but we're trying to encourage not whole families to go into those big box stores. And by the way, we get a lot of notices just from folks who are self-policing. We find out a store is not following the rules there, we're noticing them, and authorities are going to tell them so. It's not going to continue. 32,429 users of How We Feel app, up 16,000 since yesterday.
Move along next to the Associated Press.
Good afternoon, Governor. It's Sue.
Hey, Sue.
I wanted to follow up a little bit on Paul's question regarding the number of deaths. We've noticed that also that Hartford County seems to have a higher death rate than Fairfield County. I think Hartford County has like around 4,100 confirmed cases and 440 deaths versus Fairfield County that had 9,990 confirmed cases and 584 deaths. Do you guys have any idea why that might be?
Well, I was certainly talking to Dr. Coe about that today. I've focused on the same thing. One, we've got to do a better job of broadening the testing base, get out to all the communities. We talked yesterday about the underserved communities. Those that may be a little reluctant to do that test, make sure they take that test. And secondly, if you are severe, we got to make sure you go to the hospital. We've got good capacity at Hartford Hospital and the other hospitals here in the city. There's capacity here. There's there's plenty of room for folks. So I want to make sure that don't be reluctant to go there as needed. So testing and hospitalization, we have plenty of capacity for both. And I think that answers part of the question.
And also regarding the contact tracing, the governor of New York has asked former Mayor Bloomberg to look into this. Is that something that you're willing to even be part of? And also, when you're talking about looking at contact tracing, are you looking at maybe locals managing it? Would states and localities, would you, if you did actually have more people on the ground, would you be hiring people? Would these be full-time positions? Can you talk a little bit more about what you guys are actually looking at, please?
Yeah, this is going to be a Connecticut operation, and we're going to do contact tracing very thoughtfully, doing everything we can to depress the rate of increase. As I think we mentioned, we're going to run it primarily through our different local health departments spread across the state of Connecticut, just like they're doing in New Haven right now. Many of those people are volunteers in Greater New Haven. If we have to find a way to incent people to keep doing this, this is important. We can do some of this electronically through the platforms, but I was talking to Governor Baker just yesterday about this. In Massachusetts, he said, at the end of the day, what was interesting in the first couple weeks in Massachusetts is, A, to get real context, you sometimes have to make a phone call to get a sense of who that person talked to. And by the way, they thought they'd probably have a contact of 10, which would have meant, oh my gosh, the virus could be spreading quickly. But the average contact, which was real for each of those infected people, was more like 3. So that gave them some confidence that the social distancing is working.
And just quick follow-up also, does the state anticipate having to test students and staff at K through 12 schools when they reopen eventually?
Any thoughts on that?
Yeah, one of the things our Reopen CT team is doing a very detailed piece of analysis around is the testing strategy. Who do we want to test? As the testing volumes that we have access to increase, who do we want to test with what frequency? And there's a very strategic approach that they're taking to help recommend to the governor how we would want to approach that. So you'll be hearing more about that in the coming weeks.
Thank you.
WTIC 1080 News.
Hi, this number is from the Connecticut Mirror today, going back to Kimberly Hall North in Windsor. 58 residents have tested positive, 28 staff members, and a dietary worker at Kimberly Hall North Nursing Home has died. Would those who are left behind be candidates for being moved elsewhere? You talked earlier this month about the COVID-only nursing homes, or are there other facilities that are empty that you might use for sort of an overflow to space these people out?
I'll take that.
Sure. Yeah, it's one of many tragic situations that are going on in some of our nursing homes around the state right now. Our Department of Public Health team, Barbara Cass, who was at the press conference a couple of days ago, is in constant contact with our nursing homes. Some of the scenarios you described are things that can always be evaluated. You know, we do have now 3 of the alternate care facilities that have already admitted collectively about 70 COVID positive patients, a lot of additional capacity coming online. So those options are available if the operators think that that is the best way to approach that specific situation with the interests of the patients and obviously the staff, foremost in everybody's mind.
Is the state hearing from the families at all with concerns?
We can check on that.
Move along next to Connecticut Public Media.
Hi, this question is for the governor. Governor, I saw that the Connecticut Senate Democrats announced this afternoon that unemployment benefits were extended from 26 to 39 weeks. Can you provide more details on that?
You know about that? I haven't heard that.
I haven't heard that.
Let me get back to you on that.
We'll get back to you on that one.
You got another question?
Okay. Well, my one other question would be about grocery workers in the state seeking the frontline workers designation. That's a designation that could get them access to things like free childcare and free testing. Any updates on that?
Yeah, I'd like to make that a priority as soon as we can. Our only limiting factor right now is the mass. Most of them have access to mass. If they don't, they're able to get the scarves and the such. These are folks who are putting their lives on the line, so to speak, and they are frontline essential workers. So I'd like to make a priority of that. As you know, we're getting more of the masks in every day, although there has been a hiccup on the runway in China yet again, but we got a good load over the last few days right now, and the grocery workers are going to be near the front of the line.
And on the child care front, as it deals with grocery workers and our frontline workers, our executive director of the Office of Early Childhood, Beth Bai, and her team have created a program that will launch on Friday called CT Cares for Frontline Workers Program, and that will be an enhanced child care program that will allow for a short time to help during this COVID crisis with applications started on Friday, which will provide subsidies for these frontline workers to provide for their children to go to child care services in the state of Connecticut while they're still able to serve our state during this crisis. So that program will launch on Friday, and we'll have more details to provide tomorrow.
Thanks, everyone. CT News Junkie.
Hi, thanks, guys. I wanted to know, with 40% of the deaths coming from nursing homes, is anybody tracking the infections of staff? And we also used to get at least aggregate daily nursing home data in the daily updates, which I know we don't get anymore, and I know that there's supposed to be something more robust coming down the line, but can somebody talk to some of the reporting requirements for nursing homes?
Yeah, hi, Christine. So I think we had mentioned a couple times that we've moved the more complete reporting package to Thursdays, so you'll get a comprehensive update on the nursing home data in the reporting package tomorrow. As the pandemic has expanded and the volumes of data that are being reported on has increased, we've had to, in the very manual nature of reporting on some of the data points, such as the nursing home reporting, we've moved that to once a week, but we will have a lot more data on that tomorrow.
Is it going to include any tracking of staff infections or staff cases within these nursing homes?
We don't have tracking enabled for the staff at this time.
Okay. And I wanted to ask you also about Senator Fasano's letter regarding the acquisition of PPE. He seems to make an accusation that the state somehow passed up opportunities to purchase PPE.
There's no truth to that. Nobody's been more aggressive about going after the PPE than we have. Talk to the other states. We're vetting a lot of fraudulent claims out there. There's no question about that. We're going to be strict with the taxpayers' money. They don't want to be promiscuous with the taxpayers' money, that's for sure. But we have left no stone unturned in order to get the necessary protective gear that we need. It's coming in pretty well. Every nursing home is vetted every day, so we make sure they get what they need. Our hospitals are getting what they need. We're now able to expand the pie to some of our small businesses and grocery over a period of time. I think you should have confidence. This is no time for second guessing.
If I could too, there was one statement in there that's a very common misperception that I think is important to clear up as well, which is that somehow the governor's executive order around requiring people to wear face coverings when they're not able to social distance somehow makes this problem, the PPE shortage, worse. It's important for people to remember two things. One, not all PPE is the same, right? So where we see most acute shortages right now is in the high-end respirators, the N95s, disposable gowns. That's another area of tremendous shortage right now. Neither of those things have anything to do with the executive order, which is really about face coverings. And so we actually have quite a supply there, a lot more coming, but really what we're looking for people to do is to bring their own or source their own. There is CDC guidelines of how to do that very easily and very quickly. So that's not adding to the concern at all. And we just want to remind everyone that the high-end PPE, we really want to save that for our healthcare workers, nursing home workers, first responders, state agencies that are doing those types of services, the people really out on the front line with COVID patients.
Well, and there seemed to also be an accusation that the state is not putting the money up front and is missing out on some of these, deals, I guess.
Yeah, I mean, that's not true. We have done that. We also have some organizations and individuals in Connecticut that we've worked with to front money on behalf of the state to ensure that we're not missing out on deals because we're not being aggressive. That said, there is a tremendous amount of fraud out there, and we do work very hard to diligence every lead that comes in and not be haphazard about it. But we have been very aggressive when we do have legitimate leads, putting money up front when it's appropriate.
Hartford Current. Hartford Current.
Yeah, sorry about
Gotcha.
that. Can you hear me? Can you hear me?
We sure can.
Governor, I'm sorry. I just want to make sure I heard something correctly. Did you say that you hadn't decided whether to participate in Governor Cuomo's plan on contact tracing, or did you say that you weren't going to participate in it?
Look, we share information. We're going to be working with him, working with New Jersey, working with our regional governors in terms of how they're doing contract tracing, how we can work that together, checking the data across state borders in some cases, because people go back and forth and infect different people. We'll make up our mind on that pretty soon.
Okay. And one other thing, earlier, a few minutes ago, you said that a Connecticut program would be voluntary and anonymous. Does that mean that if somebody was infected and you identified their contacts, it would be up to them to decide whether or not they wanted to quarantine?
When we give you a call and we say you've been infected, and we'd like to find out who else you've been in serious contact with so they can be warned. Nobody knows who gave you that name, just that you've been in contact with somebody. And they have the right to take the phone call and say they want to participate or not.
Okay. And finally, in your preliminary thinking on this, have you run any projections on what type of manpower and what kind of expense it would entail to run an effective contact tracing regime in Connecticut in conjunction with this expansive, expanded testing program?
Let our advisory board get back to you on that over the next few days. I know that Charlie Baker did 1,000 folks on their initial tranche. That's a state that's, 70% bigger than us, just to give you one metric.
Okay, thank you.
NBC Connecticut.
Hi, Governor. Regarding the contact tracing, how do you get the contact tracing as well as the tests when there is lack of resources, tests, and people? I mean, that's been an issue across the U.S.
You may have to say that again. I missed that.
Can you repeat the question? You were cutting out.
Yeah, all right. Can you hear me okay?
Barely.
Jamie, we'll come back to you. News 8.
So to follow up on the contact tracing, what's going to happen on the other end? So it's voluntary. You call up a person, say, hey, you've been in contact with somebody. Do they have to get tested? Do they have to be quarantined? Or you just let them decide on their own?
Yeah, so people decide on their own. The experience of our public health team that has been doing this for many years is that typically people want to know that information, right? They want to know that they've been in close contact with someone that's been infected, and the vast majority of the time the people take the recommendations and self-isolate for the 14 days. But as the governor pointed out, this is all voluntary, but the more resources we have, the more people we have doing this process, the more message we can get out, the more it'll help.
And if it is a 3-to-1 ratio up in Massachusetts, for every person who tests positive, 3 people you have to follow up with, again, it comes down to testing or more self-quarantine. Will there be enough testing?
Yeah, so it's back to the first step here is the scaling up of the testing capacity. That's important. Also keep in mind that we will have 64 different health departments in the state of Connecticut that will be intimately involved. And one of the key design points that we're working on is that this is not going to be the traditional Connecticut model where everyone kind of does their own thing. We're working together. Our DPH team had a call with the local health departments earlier today. So we're working on an integrated strategy to make sure that we're able to take advantage of all the resources we have, plus volunteers, and we'll look if we need additional staff, as the governor mentioned.
You asked the right question,
It sounds like you're quite far along. How soon do you think you could roll that out? That sounds quite impressive.
We're going to be rolling it out. It's already rolling out in New Haven right now. We'll be working this out on a regional basis as well. But it's worth noting, as Josh was saying, that look, we give you a call, we find out that you've been infected. Who else have you been in contact with? As we roll out our PCR testing, traditionally we've had to say, hey, you got to self-quarantine for 14 days to see whether you're infected or not. We'll be able to test you, and you'll be able to know whether you're safe or not in real time.
Connecticut Mirror.
I'd like to follow up on the tracing issue a little bit. So if if Governor Cuomo gave the impression that there was an arrangement in place with Connecticut, New Jersey, that is incorrect. That is premature, right?
As you know, we have a partnership, and we have a partnership to compare notes, compare strategies, see what are the best practices going forward. In terms of what we're doing specifically on contact tracing, look, I look forward to working with him in a variety of different ways on that.
All right, Governor, but I just want to be clear. When it comes to Mayor Bloomberg's institute, there is not an agreement yet, correct?
There's not a formal agreement yet. That's absolutely correct.
All right. And the cloud-based program that Josh referenced, that's being developed independent of what Governor Cuomo was talking about?
Correct.
Okay. And final thing, weeks ago, the state epidemiologist said there would come a point where tracing would no longer be effective. So has the state DPH been doing tracing in recent weeks? And if so, how many people are available and under what circumstances has that tracing occurred?
Yeah, at the State Department of Public Health, we have about 20 people that support contact tracing. As Dr. Carter's pointed out, when you get to widespread community transmission like we have in Connecticut and most parts of the world right now, it becomes kind of unmanageable in the volumes. So a lot of this is about preparing the infrastructure and the processes so as we come down the backside of the slope, we're able to have good coverage on all the infections at that point in time to really prevent rebounds, which we're so concerned about once we get into the next phase of this.
So the tracing then will step up as the caseload comes down? Is that what you're saying?
Well, the tracing will step up as fast as we can get these systems up and running. We get more people enlisted in this effort. And so that's not going to wait. But it becomes even more effective when you can get to all of the cases rather than a subset of the cases.
And has this been the plan from the start, or is this something that's evolved?
No, we've known contact tracing was key to what we had to do on the back side of this and in the front side. Let's say in eastern Connecticut, where you have a much lower infection rate, Paz, there, if we can stem this through contact tracing, we can slow the spread dramatically. On the back side of this, as perhaps the infection rate starts going down, but there's a flare-up in a given community or so, we can go in there and do everything we can to tamp it down. Now, we've always known that this is going to be part of the strategy. How we roll it out, we're still figuring out.
And I'll let you go, but one last thing. Are you looking at increasing staff, or is it just the volunteers you'll be getting through the 64 health districts?
I think the latter. We're going to work primarily through those 64 health districts. Down there, they have a lot of Yale students and others who have been trained who are doing a lot of the contact tracing. And I'd like to see if I can extend that model 63 more times.
Thank you, sir.
Move along next to CT and Vivo.
Good afternoon. This is Oscar Arango with CT and Vivo. So I do have a couple of questions. The first one is, how DECD is making sure that these loans are approved to real small businesses, including minorities, including bodegas, local shops, and how are you working with those businesses without access to technology to apply? Some of these business owners don't have access to technology, and also they do speak only Spanish. And is there any organization that are helping them to do this?
Thank you for that question. Absolutely. And so again, we continue to get smarter and better at this in real time and kind of course correcting as we go to some extent. But the HEDCO loans that I mentioned earlier that are specifically targeted to women and minority businesses with 20 or less employees, again, very focused on your small mom and pops. There is a vast network of organizations that are working with HEDCO and that work with DECD to ensure that we are getting our small businesses this information and providing them technical assistance, and so that they understand the process. So one of the organizations that we are partnered with is SAMA, the Spanish American Merchants Association, that is working with specifically the Latino community to ensure that they're accessing these loans and have the requisite information to navigate resources. Do we need to do more? Absolutely, and we are continuing to refine our outreach.
Glenn, some of these business owners have been complaining or mentioning that they have applied, but they haven't received any kind of feedback. So they don't know if they're doing the correct thing, while they're applying.
Well, I would encourage them to reach out to DECD, 860-500-2333, the hotline, so they can talk to one of our community economic development specialists that can help them navigate.
Thank you. And I have another question for the governor. Governor, in New York, 2 cats were positive for coronavirus, according to federal officials today. It's Connecticut had something in mind already to tackle that and take care of the pets. Anything?
I got to get back to you on the cats. I know dogs are not carriers. Let me check on cats and see what we ought to do. Let me just say one thing, if I could. Are we done with questions, Max?
We have one more question that from technical difficulties. I'll read it. Came from NBC Connecticut. How do you get enough monitors for contact tracing as well as tests for it when there's a lack of resources, tests, and people across the country? It obviously has to be a pretty aggressive program, and they want to know if Governor Cuomo had spoken directly with you about having an army of people to contact trace.
We have talked broadly about it, and now we're going to be talking specifically about it. Contact tracing is twofold. One, it's people power, and that's where you have the human element to track down and make sure that we know who you've been in contact with so we can notice them and keep them safe. Secondly, there may be some sort of a social platform. We can do some of that electronically as well, especially as we get out to scale. So it's really important that we get that right. I just want to say we're most of the way through April. We knew April was going to be the toughest month in terms of the surge and the peak and what we've had to do to manage our way through this pandemic. I think the state's doing pretty well. I think the hospital system held up. I don't think anybody was denied. We had to catch up on the PPE. We've caught up on that primarily right now. And I'm glad that a lot of the questions about what happens next, how do we slowly get out of this sense of crisis? And I'm afraid those decisions are going to be just as important or even more important towards the long term in this state. Something that I weigh every day, Paul and Max are doing, Josh. This is why we've got the committee coming back, the committee to reopen Connecticut. I think it's tomorrow to start answering some of those thoughts about how we play through. Look, we got to get this right. To get it wrong would be really serious. To be premature would be really serious. To get it right, there'll be plenty of time for second guessing, but I think we're hanging tough on this. I think we're going to get through this. I think we're off to a good start. This month could have gone a lot of different ways, and I'm proud of the way Connecticut reacted. Thank you, everybody.